So on Sunday morning, when it all became a big issue on Facebook, was when I first became acutely aware that there was a problem with service providers. Off the main comments, off the main thread, there were then other users that were saying we've also had issues. At which point I started contacting the care agency, the providers, etc., to find out what exactly was going on.
You said that there would be a seamless transition. This is hardly a seamless transition, though.
So between the new company, Lifecome Care, and the previous providers, Medoc and Ada, there has actually been a 4-week transition period that was agreed, which was from the 23rd of September to the 20th of October. So given that the companies were working together for this transition, it was believed by all parties that it would be seamless. What has actually transpired, or what seems to have transpired, so I've literally just finished a meeting with all of the previous providers, with the current providers, with the care agency and with Unite, to try and understand what the issue has been. The issue seems to have been that the app which the employees use to access their rota has been down during this period. So what has happened is that even though the previous company, so Ada and Medoc, have provided Lifecome Care with the rotas, the employees were unable to access their rotas from their end, and hence the issue has been caused. I have today been assured that the app is now working. In fact, while sat in the room, I asked the care agency to ask care workers whether the app was working, and they confirmed that it is, so that starting today there should be no issues with care providers. Having said that, I have asked everyone around the room, everyone around the table, to work together to ensure that there are no further issues. There is also a phone number, which I am now assured will be manned 24/7, which is 200 41660, which, if there are any issues, should be called.
Minister, continuity of care, carers not turning up at the right time, that was one issue, but there were others as well, which has nothing to do with the app, such as the lack of Spanish speakers. What's been done about that?
So, for example, now we have a person answering the phone line, which is bilingual. We now have the workers. So remember that in this process, the workers that were previously employed will be to be transferred. Right? So the workers, the families, the users should have the same care as they previously had by and large. There will be instances, for example, that a worker finished slightly earlier or hasn't renewed their contract, whatever. But the workers that were in place should have been to be transferred over to Lifecome Care. So the workers will be the same, with the same language abilities as the carers that were there before.
Now, the other issue that was raised was the lack of vetting. Now, you said in your statement yesterday that the company, Lifecome Care, are contractually obliged to ensure that vetting does take place. But can you say with certainty that that has been the case?
I am assured that that has been the case, that the care agency and Lifecome Care are in a position to be able to vet every single person that is being employed. Now, the beauty of the process that we are going through, painful though it has been these past few days, is that we now have a contract in place. So HMGOG and the care agency now have a contract in place with an entity whereby all these conditions are contained. So we can now go to Lifecome Care and say, you have a legal obligation to vet each and every person, and we can ensure that that is the case.
You've had your meeting with stakeholders. I don't know if any further meetings are planned, but can you say then with certainty that as from tomorrow, the issues that have been raised by service users will not be happening again?
I can say with certainty that everyone around the table agreed to work together so that as from this afternoon, as from tomorrow morning at 7 o'clock in the morning, there would be no further issues, that the issues with the rotas would be resolved, that the issue with the app has been resolved, and that there will be no further issues for the service user. The one message that I was very clear around that table was that the people that were suffering were the service users. We have 512 packages of care, and I want to make sure that as from first thing tomorrow morning, there are no issues with any single one of those packages of care. So the care agency is actually putting staff on to make sure that they call each and every one of those service users to make certain that their carers have arrived. I think that's as much as we can say that we will do.